I think when things were deemed essential and non-essential and what needed to be limited when we entered the pandemic, heart surgery and heart care was always considered essential. There were never any restrictions on the care of people's hearts. And by its very nature and definition, it is central and essence of life. So it's very important. Now, in the new environment, there are some things to consider and some technological opportunities to take advantage of to help you in this time. Contacting your doctor's office by phone, text communications available, telehealth visits are available. But certainly the signs and symptoms of heart attack and heart failure, worsening of condition, should be dealt with right away. Delaying them can lead to a more critical situation and dire circumstances down the road. So maintenance, prescriptions need to be filled on time at the right time. New onset of significant symptoms, chest pain, shortness of breath, swelling need to be dealt with immediately. I think the first aspect is to determine the urgency of the care that you need to seek. Emergencies remain emergencies, and the hospital is safe to come through the emergency department if you need to. If you don't need to go through the emergency department, I think it makes sense to call your doctor's office, primary care, or cardiologist and communicate with the team there. One of the side aspects of the COVID pandemic has been a rapid increase in the amount of communications we do with patients via telehealth, via text messaging, and full conversations and visits over the phone. So we've become much more adept at doing that well. And I think at that time, a decision can be made between you and your healthcare provider, whether you should be coming in to the hospital or the doctor's office at that time. And if the decision is made to come in, then the appropriate screening questions can be asked and testing can be done to keep both you and your family members safe when seeking care. If you're coming through the emergency department, there is screening and testing at the front door, and people are separated with a suspicion for COVID or a patient under investigation one way, and patients without obvious signs or symptoms of COVID, something that would be more cardiac in nature, a different direction. So we see that there is a separation of patients there in an effort to minimize the spread of infection. The care that you receive would be the same. Your doctors will be wearing more masks and gloves than they typically would, and there's a little more testing. But we still have all the emergency aspects in place in a timely fashion to get you where you need to be at the right time. EKGs, blood work, cath lab, if necessary, into the operating room. Visitation has been limited at times and is changing based on day-to-day circumstances, and special efforts are made to keep communication between patients and their family and care teams and patients and their families, whether it be FaceTime, regular text updates, including families on rounds. The differences exist, but the care is similar to what it was before. I think things have changed, but I think most of our actions regarding healthcare need to remain the same as they were before. And if you have the chance to hear what's being done at the hospitals to keep people safe, I think it will allow you to be able to make those decisions with more peace of mind. But our health is our first priority, and certainly with COVID, we've become more aware of that, but things unrelated to COVID are still occurring, and they need to be dealt with the way they were before. So if you have questions or concerns, contact us, and if you need to come see us immediately, it's safe to do that as well.